So Tom, as a clinician yourself, a big part of, conducting consults, there's a lot of information that you necessarily wouldn't verbalize during a consultation. How does Heidi account for those circumstances where you as a clinician would want to provide that context but are unable to?
We have two ways that I can think of where you can just give Heidi information. So there's a context tab where you can type added things or basically say things you might not want to say out loud, whether it's examination findings or the way the patient walked in or something that you're not going to say to Heidi. Also, you can, whenever you stop a session, patient walks out of the room, you can click resume and just dictate quickly. It's a bit unintuitive because people don't feel like they can talk to Heidi, engage in that way. But you can. So if you click resume and just say whatever you want to say, like, hey Heidi, I saw a patient. They, although they said they had chest pain, they're actually pointing to their tummy, and on examination, I'm really not worried about this being a cardiovascular issue at all. That will help Heidi understand and kind of like rationalize the overall transcript. So there is a bit of education to do about. So the way I usually describe it is like, imagine a doctor, like, or me, like kind of blindfolded in the room, writing notes for you. Not blindfolded, with earmuffs on. I can only hear you, I can't see. So I've got my senses kind of dampened. And so you really need to like maybe over-present your findings slightly, like when you're examining, like maybe say things out loud that you wouldn't otherwise. Like, the breath sounds are really clear on the right side, rather than maybe just saying in and out, in and out. Like you kind of have to say things out loud.
Can clinicians manually type additional context during a consult? Yeah,
so they can also edit the notes. They can add things into that context tab as they go. And I do think we spend a lot of time trying to tune Heidi to make reasonable inferences based on what's in the transcript. If someone says that, I've had some pain, like just this weird feeling in my chest, and then later on the doctor clarifies, like, that weird feeling, is it pain? And they say yes, then Heidi will obviously stitch these things together like a real doctor would, that, okay, this is really like a chest pain presentation.
And that's a testament to our medical knowledge team who work behind the scenes.
Exactly. And still not perfect, these things aren't perfect. The clinicians still have to review the outputs. In particular, very challenging scenarios where, it's like a lot of what's happening in the room is not said verbally, especially for mental health visits. It's very tricky. The way someone says something is just as important as what is actually said. The best way I think to handle that is with that context tab or resuming. You can always just click resume and just tell Heidi, what your perception of the visit was. And that will help us write a really good note.